Hi everyone, and welcome to our module on the venous drainage of the lower limb. Now, the venous system of the lower limb comprises of a number of veins that tend to drain deoxygenated blood from the lower limb back to the heart. We tend to divide the venous system of the lower limb into three major veins. This includes the superficial veins, veins found within the skin, the deep veins, veins found within the deep fascia and accompanied by the deep arteries. And then we have the perforating veins, which are veins that are connecting the superficial veins to the deep veins. Usually, these perforating veins tend to drain obliquely and they run from the superficial vein to the deep vein, so they are draining blood from superficial to deep. And one important thing to note about all these veins, or whether superficial, deep, or perforating, is that they all contain large number of valves that allows for unidirectional flow of blood from distal to proximal back to the heart. Let's start with the superficial venous system. These are veins that are located subcutaneously within the skin. They are connected to each other and as a result also connected to the deep veins through the perforating veins. They tend to have a number of valves and this ensures that they drain unidirectionally. So they drain in a single direction. They drain from the distal part of the limb to the proximal part of the limb and then towards the heart. There are three major superficial venous systems of the lower limb. This includes the dorsal venous network, which we'll talk about now, and then we'll talk about the remaining two, the greater and the smaller saphenous veins. The dorsal venous network or the dorsal venous arc are constellations of veins found around the feet. They are the starting point of the superficial venous system of the lower limb. They include dorsal digital veins that are draining venous blood from the toes. This begins and runs along the dorsal margin of each toe towards the feet, towards the dorsum of the feet. At the dorsum of the feet, they unite together to form what we call the dorsal metatarsal veins, and eventually they give rise to the dorsal venous arc. The dorsal venous arc tends to be found subcutaneously on the feet, and if you ever get to cannulate the feet, you see this arc of venous system being very prominent around the dorsum or the subcutaneous part of the foot. The second superficial venous system is the greater saphenous vein. This is a vein that originates from the dorsal venous arc, which we just talked about. They tend to originate medial from the medial end of the dorsal venous arc. So if you look at the dorsal venous arc in this image, you notice that on the medial part of the dorsal venous arc, there's a continuous vein that ascends proximally. That vein is what we call the greater saphenous vein. You can see the greater saphenous vein here, originating from the medial part of the dorsal venous arc. Once the greater saphenous vein originates from the medial portion of the dorsal venous arc, it starts to ascend towards the proximal part of the lower limb. It passes at the ankle in front of the medial malleolus. Is very important to remember, and then ascends towards the leg. At the leg, it tends to be found on the medial aspect of the calf, and it's accompanied by a very important nerve, the saphenous nerve, which is a branch of the femoral nerve, and it ascends towards the knee. At the knee, it runs behind the medial condyles of the femur and the tibia, so it practically runs behind the knee joint and then ascends towards the thigh. At the thigh, it is also found on the medial aspect of the thigh, running towards the femoral triangle. Look at the course of the greater saphenous vein in this image. You can see closely that as it originates from the medial part of the dorsal venous arc, it runs in front of the medial malleolus around this region, around the ankle, then runs on the medial aspect of the leg towards the knee. At the knee, it wraps around the back of the knee, then emerges again at the medial aspect of the thigh to terminate at the femoral triangle. At the femoral triangle, the greater saphenous vein becomes deep. So it becomes deep by piercing through a fascia called the clavicle fascia and enters into a space called the saphenous opening. At this phase, the greater saphenous vein tends to enter into or terminates by entering into the femoral vein. So it becomes deep and then eventually joins with the deep vein, which is the femoral vein, and that's how it tends to end. So all the venous blood being drained by the greater saphenous vein eventually will be drained into the femoral vein. What are the tributaries of the greater saphenous vein before it terminates? These are veins that tend to also drain blood through the greater saphenous vein into the femoral vein. They include the short saphenous vein, the short or small saphenous vein, which is the third vein we'll talk about as part of the superficial venous system of the lower limb, tends to be communicating with the greater saphenous vein, so it's one of the tributaries. Then we have the superficial external pudendal vein, the superficial circumflex iliac vein, superficial epigastric vein, and then the lateral femoral cutaneous vein. These are all veins that tend to have their tributaries terminating at the greater saphenous vein. Look at the picture here. You can see in the saphenous opening where the greater saphenous vein tends to terminate. We see a number of veins that tend to enter into it prior to its termination in the femoral vein. You can see the superficial epigastric vein here. You can see superficial circumflex iliac vein here. You can see the lateral and medial accessory saphenous veins and others that penetrate into the greater saphenous vein as it's about to terminate in the femoral vein. The third vein of the superficial venous network is the small or short saphenous vein. This arises also from the dorsal venous arc, but particularly arising from the lateral end of the dorsal venous arc of the foot. So if you trace the dorsal venous arc in this image, you could see that its medial end becomes the greater saphenous vein. The lateral end, whereas, becomes the small or short saphenous vein, which is what we can see in this image. The small saphenous vein, once it originates at the lateral end of the dorsal venous arc, begins to ascend the leg. At the ankle, it tends to be found behind the lateral malleolus. This is in contrast to the course of the great saphenous vein. The greater saphenous vein tends to course through the front of the medial malleolus, whereas the small saphenous vein courses through the back of the lateral malleolus. As it ascends through the leg, it is found directly at the back of the leg, posteriorly, and it's found on the midline of the calf. So usually found just in the middle of the leg, as you can see. This is the short or small saphenous vein ascending in the middle of the calf and towards the knee. It is accompanied by the sural nerve, and this is in contrast to what we saw in with regards to the great saphenous vein. Great saphenous vein is accompanied by the saphenous nerve as it's coursing through the leg towards the thigh, whereas the small saphenous vein is accompanied by the sural nerve as it's coursing through the leg towards the knee. The small saphenous vein ends at the knee. It ends particularly at the popliteal fossa of the knee. It pierces through the popliteal fascia to become deep. So the same way in which we had the greater saphenous vein piercing through the cruciate fascia to become deep at the femoral triangle, we also have the small saphenous vein piercing through the popliteal fascia to become deep at the popliteal fossa. And within the popliteal fossa, it terminates by emptying into the popliteal vein. Let's talk about the deep venous system. The deep venous system are veins found in a deep fascial compartment of the lower limb. They are veins that tend to be accompanied by their corresponding artery, and they share a unique name with the artery. So when we talk about the femoral artery, the anterior posterior tibial artery, each of those arteries, and the popliteal artery as well, each of these arteries tend to have corresponding veins, and these are the deep veins of the lower limb. It's a picture of the deep venous system of the lower limb. You could see the anterior and posterior tibial vein, and also the peroneal vein. We talked about a corresponding artery when we talked about the arterial system to the lower limb. You can see how each of those veins will give rise to the femoral or popliteal vein, and eventually the femoral vein, which would end at the inguinal ligament. Let's talk about the deep veins of the foot, starting with the veins found within the dorsal and plantar aspect of the foot. We have a number of veins that tend to unite, forming eventually the anterior and posterior tibial vein. We have the digital veins and the metatarsal veins, are veins of the toes. Then we have the deep plantar venous arc and the medial and lateral plantar veins. These are veins that will give rise to the posterior tibial vein. Each of these veins are found in the feet, and they are involved in draining deoxygenated blood from the feet down all the way up rather to the legs. The deep veins of the leg includes the anterior tibial vein, the posterior tibial vein, and the peroneal or fibular vein. These are veins that are accompanied by the arteries. So the anterior tibial veins are accompanied by the anterior tibial artery. The posterior tibial vein is accompanied by the posterior tibial artery, and the fibular or peroneal vein is accompanied by the peroneal artery. These veins tend to ascend towards the knee, and at the popliteal fossa, they tend to unite together to give rise to the popliteal vein. The popliteal vein is the third vein in the deep venous system of the lower limb. It arises from the union between the anterior tibial vein, posterior tibial vein, and the fibular or peroneal vein. And it's found directly in the popliteal fossa. It ascends through the popliteal fossa, and beyond the popliteal fossa, the popliteal vein becomes the femoral vein. In the popliteal fossa, it is found behind the popliteal artery. So the artery, remember, is the deepest structure on the popliteal fossa. After the artery, superficially, we have the popliteal vein. Then beyond that, we have the sciatic nerve and its branches. In terms of its termination, popliteal vein tends to terminate by passing through the adductor hiatus. The adductor hiatus is the separation between the adductor canal superiorly and the popliteal fossa inferiorly. So it's the entrance of the adductor canal. So once the popliteal vein crosses through the adductor hiatus, it becomes the femoral vein. We stop calling the popliteal vein. We start to call it the femoral vein. The major tributary of the popliteal vein is the short or small saphenous vein. This is a superficial vein that tends to terminate in the popliteal vein. One thing to remember about the short saphenous vein or small saphenous vein is the fact that it has tributaries that extend towards the popliteal vein as well as the greater saphenous vein. We usually say that the small saphenous vein splits into two. One of it will drain into the popliteal vein, the other one drain into the great saphenous vein. Finally, let's talk about the femoral vein. Femoral vein is the continuation of the popliteal vein at the adductor hiatus. It ascends through the adductor canal and then eventually enters into the femoral triangle. At the femoral triangle, it is accompanied by the femoral artery, and it tends to receive a number of tributaries, which we'll talk about next. One thing to note about the femoral vein within the femoral triangle is that it is related medial to the femoral artery and is found wrapped together with that artery by the femoral sheath. The femoral vein terminates at the inguinal ligament. As it crosses through the inguinal ligament, we cease to call it the femoral vein and we start calling it the external iliac vein. In terms of its tributaries, the femoral vein is going to be receiving a number of branches, including the profunda femoral vein, the medial circumflex femoral vein, and the lateral circumflex femoral vein. These are all veins draining into it. Very important to also note that the greater saphenous vein also drains into the femoral vein as a tributary. Let's end this session by talking about some of the clinical significance to the venous drainage of the lower limb. This includes the formation of varicose veins, thrombophlebitis, venous grafting, and then what we call deep vein thrombosis. This is a picture of a varicose vein on this image, this side of the image. Varicose veins are abnormal dilatation of veins of the lower limb and is usually due to problems with backflow of venous blood through the veins. Usually, a vein within the lower limb, either superficial or deep, tend to have valves. Valves, like I said, allows for unidirectional flow of blood from distal to proximal towards the heart. In the case where we have incompetent valves, where the valves are not functional, we have what we call a bidirectional flow of blood. Instead of blood flowing from distal to proximal, we have a backflow of blood from proximal back to distal, and as a result, we have blood accumulating within the veins. This accumulation of blood into the veins is what leads to the dilatation that we see, and that is what we call varicose veins. Is an actual image of a patient with a varicose vein. On the right side of the image is a patient that doesn't have a varicose vein, which has veins of the lower limb that have competent valves. On the left side, we have the veins with incompetent valve, and as a result, this leads to engorgement of the veins with blood, and automatically varicose veins appearing in this patient. A second very important clinical significance is deep vein thrombosis. Deep vein thrombosis simply refers to the formation of clots in the deep veins of the lower limb. Remember that the deep veins of the lower limb include the femoral vein, popliteal vein, the anterior and posterior tibial vein, alongside some veins of the feet. Now, if you have sluggish venous flow of blood through these veins, you could have formation of clots, and formation of clots usually is what we call thrombosis. And thrombosis at this part of the vein tends to be very dangerous because of the fact that you could have the clot dislodging, forming what we call an embolus and traveling all the way up towards the heart. Usually, these embolus tend to get stuck at the venous supply to the venous arterial supply to the lungs, and this could eventually lead to what we call pulmonary embolism. So one important thing about deep vein thrombosis to note is that it tends to occur in people that are immobile, people that have been hospitalized and that are unable to move, people that had pelvic surgeries, that have malignancies. Usually, they tend to be the ones being predisposed to deep vein thrombosis because of stagnancy of flow of blood towards the heart. One other important thing to note is that for the flow of blood to be maintained, we have some general factors and local factors that affect flow of blood in the deep veins of the lower limb. So some general factors include things like valves. Valves help in the unidirectional flow of blood, like I said. Other factors could be local factors like the muscle of the lower limb. The lower limb, especially the legs, tend to have very large calf muscles, like the gastrocnemius and the soleus muscle, that help in contracting flow of blood towards the heart. So whenever we have the muscles being used, the muscles will compress the deep veins, and they will lead to unidirectional flow of blood towards the heart. The deep fascia of the legs and the thigh also help. So deep fascia, the muscles are also involved in helping the flow of blood and preventing clot formation. So please, it's important to note the local factors and the general factors that are necessary for the flow of blood from the distal part of the lower limb to the proximal part and towards the heart, and eventually preventing deep venous thrombosis from forming. That concludes our module on the venous drainage of the lower limb.